The national smoking rate is 18%, but that's too high, and the number has stalled. How to get it down further to 12%, which is the government's goal by 2020? The answer is electronic cigarettes. E-cigarettes are cigarette lookalikes with one radical difference. They do not produce smoke, and it's smoke that has the tar and the gases that cause cancer and other diseases. So the issue with e-cigarettes is not so much are they safe, but are they safer? One of the biggest concerns that critics have is that electronic cigarettes will be smoked by teenagers who will then go on to use regular cigarettes. If this happens, this will be a problem, no question. But so far, data from the CDC show that this sort of gateway effect is not happening. People use electronic cigarettes in two basic ways. They use it to either quit nicotine altogether, which is to say they smoke, they switch to electronic cigarettes, and they gradually get themselves off the electronic cigarettes. In fact, e-cigarettes come in various strengths of nicotine to help you wean yourself off. Other people just switch to e-cigarettes and use them as an alternative to smoking. Either way, the gases and the tars are not there because there's no tobacco being burnt. People do expose themselves to nicotine over time, but that is not the lethal component of smoking. However, because nicotine is an addictive substance, it should be banned from being marketed or sold to minors. Electronic cigarettes reduce harm in smokers. From the policy-making perspective, the goal is to make e-cigarettes more attractive than smoking. That's how people will switch. And the ways to do it are to not tax them or tax them at a very low rate, to give away free samples in adult environments. With 1 out of 5 deaths annually attributed to smoking and billions of dollars each year in health costs and productivity losses, if smokers switch to e-cigarettes, the number of lives saved every year would be enormous.